Hi everyone. Today let's discuss about few case study related questions for DHA MOH and hard exam for pharmacists. The first question is a 35-year-old patient who is taking anti-epileptic medication for atonic seizure has developed aplastic anemia and hepatitis. Which of the following anti-epileptic drug is likely to be the cause of this condition? Options are ethosuximide, felbamate, levetiracetam, and carbamazepine. The answer is option B, felbamate. The second question is a patient come to the pharmacy with mosquito bites. Which of the following preparations would be more suitable? Options are hydrocortisone, paracetamol tablet, benzocaine spray, and fusidic acid cream. Here, the answer is hydrocortisone because it will help with the inflammation and itching associated with mosquito bites. Next question is a 2-day old baby developed an episode of seizure. Which of the following anti-epileptic is the most appropriate choice for the patient? Options are phenobarbital, gabapentin, diazepam, and phenytoin. Here, the patient is an infant. Um, the baby is only 2 days old. So, the most appropriate choice for this condition is phenobarbital. So, the answer is option A, phenobarbital. Question number 4. A 35-year-old patient who is taking anti-epileptic medication for seizure disorder has developed gingival hyperplasia. Which of the following anti-epileptic drug is likely to be the cause of this condition? Options are levetiracetam, lamotrigine, carbamazepine, and phenytoin. So, one of the major drug, especially anti-seizure drug, which can cause gingival hyperplasia or the bulging and inflammation of the uh, gum, which is phenytoin. So the the answer is option D, phenytoin. Next question is a woman comes to the pharmacy with sunburn. Which of the following should be advised first? Option A, apply a smooth soothing antiseptic cream. B, drink plenty of water. Option C, apply a local anesthetic. Here, there is a chance for dehydration in such conditions, especially in case of sunburn. So, the, so here the answer is option B, drink plenty of water first. Next question is, a patient is prescribed for silver nitrate for the removal of warts on his hand. What are the things you should remember him as a pharmacist? Option A, it can cause chemical burns. Option B, protect surrounding tissue or skin. Option C, it may stain fabric and skin. Option D, all the above. Here, the answer is option D, all the above. Seventh question, which one of the following is the most appropriate for the management of upper respiratory tract infection in a patient who is allergic to penicillin? The options are trimethoprim, clarithromycin, coamoxiclav, and cefuroxime. Here, the correct answer is option B, clarithromycin. Next question, which of the following drug may cause drowsiness? Option A, codeine. Option B, sumatriptan. Option C, tramadol. And option D, all the above. Here, all of these medicines can cause drowsiness. So, The answer is option D, all the above. Question number 9. How many tablets of prednisolone 5 mg should be dispensed to a patient who has been prescribed prednisolone 25 mg per day for 5 days? Here, the patient required total 25 mg of prednisolone every day. So for that he need 5 tablets every day. So for 5 days he needs 5 into 5, 25. So the correct answer is option C, 25 milligram. Next question is, which preparation could be used systemically in the treatment of acne? Option A, clindamycin. Option B, salicylic acid. Option C, benzoyl peroxide. And option D, all the above. Here, salicylic acid and benzoyl peroxide can be used for the treatment of acne, but only as a topical preparation. So, the answer is option A, clindamycin. Thank you for watching the video. If you have any doubts or questions, please comment below, and please do subscribe the channel for more videos like this. Thank you.